Carty. So on this episode, we'll be talking about diabetes prevention, and I'm going to hand over to Dr. Carty, who will be teaching us more about diabetes and preventive ways and for how to manage our diabetes for those who have it. And for those who are caring about knowing how not to become a pre-diabetic, or have those situation in your family wherein you're worried what to eat and what not to eat, I think this show would be a very good show for us all and for us to learn. Whether we have it in our family or not, diabetes is a very big issue in our society. It's one of the biggest disease that affects people of all races and affect our people. So without much introduction, Dr. Carty started last week, and I am going to hand over to Dr. Carty and ask him to please unmute his mic. Thank you for being here, Dr. Carty. Please unmute yourself, sir. Okay, sorry. Can you unmute yourself, sir, please? I mistakenly pressed the button. Great.
Okay, that's it?
Yes, sir.
Testing, 1, 2, can you hear me?
Yes, we can hear you. Yes, sir.
Okay, thank you. And a very pleasant good night to everybody, and I'm grateful for the opportunity to come and to share with you again. For those of you who may not know, I'm the director of Marine Natural Health Consulting here in St. Kitts. In addition to my regular work, I practice as an educational health and wellness consultant. And what we do at Marie is to encourage people to empower your mind, to enhance your body, and it's a healthy life. I just want to remind us that the information I'm sharing tonight is for educational and informational purposes only. It is not intended as medical advice. So it should not be used to diagnose or treat any illness, metabolic disorder, disease, or health condition. In fact, I would suggest where you have a health problem, or if you're planning to start even an exercise program, that you would check with your primary care physician first. All right, so thank you very much. And I think we can go straight into our presentation for tonight. I'll just share my screen here. Okay. Okay, can you see my screen?
Yes, sir, I can see it.
Okay, thank you very much. And so you'll notice that you'll notice that the topic for tonight is overcoming diabetes. And mainly we are going to be speaking about how to prevent and reverse diabetes. What we're going to be discussing tonight are 5 different things. We are going to review the incidence of diabetes. Then we are going to attempt to define it so that people could understand exactly what we are talking about when we use the term diabetes. We're going to determine the causes of diabetes. We're going to look at some of the effects of diabetes, and then we're going to learn how to prevent or even reverse this condition. And so, very quickly, in the old days, diabetes was first identified based on the fact that individuals noticed that the urine had a lot of sweet in it. And they noticed that because ants would be following the urine. You know, people in those days did not have flush toilets or urinals as we have them today. And so they would place it on the ground and they would go back and look and see ants following it. And that is why it's referred to as diabetes mellitus, meaning excess sugar in the blood. Now, how many people have diabetes? You look at that picture and you cannot count the people in that picture. Now, of all the people with diabetes, up to about half of them don't even know they have it. In fact, many become aware of their own disease condition only when they begin to experience potentially irreversible problems. And so, within the last 25 years, the incidence of diabetes has been growing, and we are told that in the next 25 years, it will double to almost 300 million people. So we know then that diabetes is a worldwide condition, it's a global condition, and in fact, in most countries, that is the highest incidence in terms of the non-communicable diseases. So there'll be more people suffering from diabetes mellitus than, for instance, say from hypertension, arthritis, or any of the other chronic diseases. Diabetes has the highest incidence. Now, some kind of foods help our bodies to grow, and others give us energy. So the energy foods are changed in the body to something very sweet, and that is called glucose. So remember that whenever you eat energy foods like the carbohydrates, the starches, the sugars, these foods have nutrients, maltose, sucrose, various sugars, and they're converted into the simple sugar called glucose. And then glucose actually goes into the blood to become the energy source for the body. The blood, it actually becomes sweet after we eat foods, so that the more carbohydrate foods you eat, the sweeter the blood is going to become. Now let's look at an analogy. Gasoline is the fuel for the car. So as gasoline is the fuel for the car, so is glucose the fuel for the body. Okay? Gasoline for the car, glucose for the body. Just remember that. So we need fuel just like the car needs fuel. Now, gasoline in the car changes into energy in the presence of oxygen. So oxygen is that combustible part of the process here. So without oxygen, the gasoline will not be able to function. Now, in the body, glucose changes to energy in the presence of insulin. So recognize gasoline is to the car as glucose is to the body. Oxygen is to the combustion of the gasoline in the car as insulin combustion of glucose in the body. So that without insulin, you would not be able to change that glucose into energy. And that is something I need you to remember as we move forward. So exercise helps the body use that energy that you get from the food. But remember, in order to get that energy, there must be glucose. The insulin then pushes the glucose into the cells to provide us with energy. And so, as this young lady says, the blood stays sweet in the body if it cannot use the energy. So notice, if that glucose is not getting out of the blood into the cells to give you energy, the blood will remain sweet. So that leads us then to our definition. What is diabetes mellitus? Now, diabetes mellitus is a condition that occurs when the body cannot use sugar or glucose correctly. This is because the body either stops producing or does not produce enough insulin. And as I said, insulin is that hormone that helps the body to use the glucose. So the amount of sugar in the blood then rises to dangerous levels. And comes from Dr. Michael Tira. He was one of my herbology professors when I studied natural medicine. So there are 3 different types of diabetes mellitus. And very quickly, before we go further into discussing these, you'd notice I use the term diabetes mellitus because there's another type of diabetes referred to as diabetes insipidus. Now, diabetes insipidus refers to too much water in the system. So if there's too much water in your system, then you're suffering from diabetes insipidus. But if there's too much sugar, then you're suffering from diabetes mellitus, okay? So as I said, there are 3 types of diabetes mellitus. The first one is what we refer to as type 1 diabetes. The second one is referred to as type 2 diabetes. And then the third one is referred to as gestational diabetes mellitus, or GDM. And so we look quickly at each one. So type 1 diabetes, in fact, it was previously known as insulin-dependent diabetes. It's an autoimmune disease that occurs when the body's immune system destroys the insulin-producing beta cells in your pancreas. Now remember this, type 1 diabetes is an autoimmune disease, so that the body is turning on itself. Your body's immune system destroying the beta cells in the pancreas, and those are the cells that should produce insulin. So we take a little trip down biology lane, and you notice here is your liver, the stomach is here, the large intestine, small intestines, and this little organ right here, that's your pancreas. That is the organ which houses the beta cells that produce your insulin. So inside of the pancreas are these tiny microscopic endocrine glands called pancreatic islets or islets of Langerhans. And these glands are little clumps of cells scattered like islands, as you can see them here. Now there are two different types. There are the alpha cells, they secrete glucagon. So the green ones are the alpha cells, okay? And the yellow ones are the beta cells. These are the cells which secrete insulin. Okay, and when the immune system attacks the pancreas, it actually attacks those yellow cells, the beta cells, prevent them from secreting the insulin. Then these are the white cells over here. These are the exocrine cells. These cells secrete enzymes for digestive purposes. Okay, just a little trip down biology lane. So if the blood glucose level is high, insulin decreases the blood glucose by speeding up its movement out of the blood. And so it goes through the cells, membranes, into the various body cells, okay? That is if the glucose level is high. Now, if the beta cells secrete a normal amount of insulin, then a normal amount of glucose enters the cells, and a normal amount of glucose stays behind in the blood, so that your normal blood glucose level should be anywhere between 70 to 110 milligrams of glucose in every 100 milliliters of blood, okay? Now, your healthcare professionals will tell you that what you need to do is make sure your blood sugar level does not go above 90. So they use 90 as a kind of average, but the range is between 70 to 110, where 90 is just in the middle of that. Okay, so if your blood sugar is 90 or below, you're doing fine. If it's above 90, then you need to just make sure you be cognizant that you do not increase your blood sugar level too much. In fact, if it's above 90, you'd want to check to find out whether you are either pre-diabetic or in a diabetic condition. Now, if the beta cells secrete too little insulin, then less glucose leaves the blood to enter the cells. So the blood glucose level increases, and sometimes even to 3 or more times the normal level. And as I said, that is referred to as type 1 diabetes mellitus. Now, I just want to share something very quickly here, because most of you would notice that type 1 diabetes tends children even more than adults. And science has come up with one main reason. There might be other reasons, but one of the things that has been observed is that many children cow's milk to drink at an early age. The cow's milk has a protein in it, and the protein molecules are very similar to the beta cells in the pancreas. Now, I want you to hear this. Now, when children ingest cow's milk, the body recognizes those protein cells in the cow's milk antigens, or as not belonging to the body, so that the body recognizes it as something which is not food. Hence, the body will produce antibodies to destroy those in the milk. Now, those antibodies will destroy the protein cells, yes, but because the beta cells are very similar to those protein cells, then the antibodies will turn on the beta cells and destroy those beta cells as one. Hence, little children tend to develop type 1 diabetes as a result of that process. So mothers would be it would be wise to take note of the fact that you can be impacting your child by giving them cow's milk, and so you would want to find alternatives for your children. Okay, so type 1 diabetes mellitus, also known as juvenile onset diabetes, accounts for 10 to 15% of all people with diabetes. And as I said, this is mainly in young people. That's why it's referred to as juvenile onset diabetes. So these individuals have lost the ability to make an adequate amount of insulin, and they must take insulin by injection. And so on a daily basis, these people have to take insulin, and they become what we refer to as insulin dependent. Insulin dependent. Okay, we continue with the second type of diabetes, and so we go to type 2 diabetes. Now, type 2 diabetes, previously referred to as non-insulin dependent diabetes, is now known as late onset diabetes. And it is referred to as late onset diabetes because, converse to children, adults who get type 2 diabetes will get it later in life, probably in the 30s, 40s, maybe 50s. That's why it's referred to as late onset diabetes. And it is characterized by what is referred to as insulin resistance and relative insulin deficiency. Now, when type 2 diabetes is diagnosed, the pancreas is usually producing enough insulin, but for some unknown reason, the body cannot use that insulin effectively. Hence, the condition is referred to as insulin resistance. It is as if the body is resisting its own use of insulin. And so, rather than that insulin being used to drive the sugar out of the blood, the insulin is being resisted, hence the sugar stays in the blood. And after several years, insulin production decreases, and the result is the same as for type 1 diabetes. That is, the sugar stays in the blood as a result of the insulin not being able to do its work. So glucose builds up in the blood, and the body cannot make efficient use of its main source of fuel. So one, the glucose stays in the blood. Two, the individual is not getting the fuel that you need to effectively function. And so you would recognize, therefore, that one of the symptoms of diabetes would be fatigue. But we are going to look at those symptoms a little bit later. Now, diabetes is said to be strongly genetic in origin, but lifestyle factors such as excess weight, inactivity, high blood pressure, and poor diet are major risk factors for its development. Okay, and while it is genetic in origin in some cases, in most cases, the genetic aspect of it is type 1 diabetes. So while type 1 diabetes could come as a result of the body's reaction to proteins and to destruction of the beta cells, it could also result as a means of heredity. And again, science shows that only about 5% of the cases of diabetes are hereditary. The bulk of the cases are actually lifestyle-based. That's mainly type 2 diabetes. Type 2 diabetes is the most common form of diabetes. In fact, while type 1 diabetes affects 10 to 15% of all people with the disease, type 2 diabetes affects about 85 to 90% of all the people with the disease. So you see the big disparity between type 1 and type 2. Type 2 diabetes, and the symptoms may not show for many years. And by the time they appear, significant problems may have developed. In fact, most people don't know they have diabetes until one of those significant problems has developed. Okay, we continue now with third form of diabetes that is referred to as gestational diabetes mellitus, or GDM. And that type of diabetes, also referred to as carbohydrate intolerance, is first diagnosed during pregnancy through an oral glucose tolerance test. So that's where you see it in most cases. Now, while the carbohydrate intolerance usually returns to normal after birth, the mother has a significant risk of developing type 2 diabetes. So you see, a pregnant woman can start off with gestational diabetes, but then could end up with type 2 diabetes, while the baby is more likely to develop obesity and impaired glucose tolerance and or diabetes later in life. And that is why during the prenatal care, the blood sugar of the mother is carefully monitored to ensure that it is not going up into a critical level to actually cause gestational diabetes. Okay, now to look at the causes of diabetes. Type 1 diabetes affects mainly young people, as I said earlier, even in small children. And while there has been no conclusive reason for a while, as I said earlier, we have come to recognize that giving animal milk to babies too early could be one of the main causes. And so mothers should be encouraged to breastfeed for as long as possible, or where that is not possible, then alternative milk sources should be sourced. Now, juvenile onset diabetes is considered an inherited condition. It usually begins with long-standing stomach heat along with spleen deficiency. And so as the Chinese would tell us, they have a treatment which is referred to as TCM, and they use that approach mainly with juvenile diabetes, okay? Now, the liver and the stomach heat could cause an abdominal rise in appetite. And so if you recognize that your infant or your toddler seems to be craving food and very fast, then you might want to check on the liver, you want to have a check on the stomach. You might even want to check on the spleen, because again, spleen deficiency could be caused by that same overeating, especially if they're eating too much sugary products. And this is one of the things in our culture we notice, that parents tend to give children sweet things. There's some culture that says, babies tend to like sweet things, so you give them sweet things. And what happens is that we develop what is called a sweet tooth in children at a very young age. They get too much sweets, sugar, carbohydrates, fatty foods, and then the worry and insufficient exercise comes along with that and triggers the type 1 diabetes. Again, overeating hot, spicy, greasy, fatty foods, thick flavored foods can also be a cause. And for those individuals who consume alcohol, especially if mothers are drinking alcohol while pregnant, they're not supposed to, especially in the first 3 trimesters, but there are some individuals who are addicted and they, stay with the alcohol for a while, and even that can trigger those problems in children. Okay, so we go to type 2 diabetes now. Type 2 diabetes, 3 main causes. 1, being overweight. 2, eating too much fat. 3, not exercising, or what we refer to as inactivity. So those are the 3 main causes of type 2 diabetes. Why do people become overweight? Because they simply eat too much. Meaning you're taking more calories than you are expending via exercise or work, as the case might be. Now, diabetes is rare in areas of the world where the fat intake is low and obesity is uncommon. So where individuals are on a low-fat diet and where they are very active, you would find low incidence of diabetes. Again, a sedentary lifestyle, as you see this young man, he prefers to sit on his couch, and his only exercise is to just twiddle his thumbs on the remote, and that's about it for him. But that could be one of the primary contributors to obesity as well as to insulin resistance. So I would encourage to get on the move. And what are some of the signs of type 1 diabetes? If you have type 1 diabetes, one of the first things you would notice is excessive thirst. You just want to drink water. And the more water you drink, it seems like the more water you need. You just feel thirsty all the time because the mouth is very dry. So that's another sign or symptom of type 1 diabetes, dry mouth. And then because you are drinking water frequently, then there's going to be frequent urination because that water has to have somewhere to go. So notice excessive thirst, dry mouth, frequent urination, excessive appetite. The individual just wants to keep eating and eating and eating, and more often than not, they gravitate towards junk food. And then there is unexplained weight loss. I mean, you look at this. You see an individual who was nice and plump all of a sudden losing weight, and you're wondering why. It might be a sign that type 1 diabetes is present. Other signs of type 1 diabetes, fatigue. The individual feels weak and tired most of the time. As I said earlier, the reason for that is because the fuel is not getting to the body cells and muscles to provide that energy for you to work. And so there's that tired feeling. And then there's blurred vision, numbness or tingling in the hands or the feet. And sometimes there is loss of consciousness. Now that is very rare, but it happens on some occasions where an individual has type 1 diabetes. We look now at the symptoms of type 2 diabetes. And believe it or not, the signs or symptoms of type 2 diabetes are very similar to those of type 1 diabetes. And so since a picture is worth 1,000 words, we just put the pictures there. You remember excessive thirst coupled with dry mouth, urination, increased appetite, weight loss, unconsciousness from time to time, fatigue in most cases, etc. So those are the main symptoms, but there are some others. So that these I'm going to introduce you to now are specific to the type 2 diabetes, okay? Slow healing of cuts and sores. And so that is sometimes one of the ways people recognize that they have diabetes, because there is that cut that just will not heal. And then there's itching of the skin, especially in the groin and vaginal areas. There are yeast infections around the jaw, the teeth, the toes. You can see the yeast here in this picture. Where is my cursor? Right here. You can see the yeast fungus showing up itself in the toes. So that candida shows itself in various parts of the body. And then, whereas there's weight loss in type 1 diabetes, there's usually weight gain associated with type 2 diabetes. So those are the main symptoms. Now let's look at the effects of diabetes. Now, as the disease progresses, its effects become devastating. In fact, it affects all of the organs in the body, and it will gradually destroy them. So let's take a look at some of them. 8 out of 10 diabetics develop eye problems, including blindness. And heard the term glaucoma. Some individuals who also tend to suffer that problem. So there are eye problems, and then there is kidney damage. Diabetics are 18 times more likely to experience kidney damage. In fact, many of them experience kidney failure, and that is one of the reasons for dialysis. You know, some individuals might be on dialysis once per week, twice per week, up to 3 times per week. Some individuals might be on dialysis because of kidney failure as a result of diabetes. In this picture, you see one good kidney there, but one bad kidney here. So that kidney has failed. And so in order to help the good kidney, the individual has to be on dialysis. Okay? And then there is a risk of heart or stroke. In fact, we are told that diabetes is a promoter of a disease called atherosclerosis, or hardening of the arteries. And this is the plugging of the arteries. Now, the heart may become weak and may even stop suddenly, especially if the plaque in those arteries break off and form a clot. That clot could lodge itself in one of the coronary arteries, going to the heart, stops that muscle from getting energy. Myocardiac infarction sets in, the individual has a heart attack. If it becomes ischemic, then the individual can actually die. Okay, and so for this reason, diabetics are 2 to 4 more times more likely to suffer from heart attacks and stroke, because the same thing could happen to a blood vessel leading to the brain. If there's a clot going into one of those blood vessels leading to the brain, stops the blood flow to the brain, then the individual suffers a stroke. So there could be heart attack or stroke as a result of that. Okay, and then there is brain damage. The person may have a stroke, as I said, but the brain damage could actually cause other problems such as memory loss, dementia, Alzheimer, even paralysis of various parts of the body, depending on which area of the brain is impacted. And not only is the brain impacted, but the nerves and the circulation are also impacted. You would have heard of individuals who suffer, as I mentioned earlier, the tingling in the legs, the feet, and the toes, and then they may have circulation, and if that poor circulation sets in, it means that the extremities are not being fed, and so if the tissues in the toes and in the foot are not being fed, then that gangrene can set in because the tissues begin to die, and eventually you might lose the toe, maybe a few toes, maybe the foot itself, you see, as a result of that. And so amputation could be the result, and a diabetic foot looks like as a result of poor circulation in the leg, okay? And then we go, and in addition, diabetes could increase your chance of sexual impotence, ulcerative sores, infections, amputations, breast and urine cancers, you name them. So keeping your blood sugar levels near the normal range is the best possible defense against the complications of diabetes. Notice there are many and they are varied. They affect almost every organ of your body. And so you want to make sure that your blood sugar level remains normal for as long as possible. Okay? There are ways to find out if you are diabetic. So the question is, how can I know if I have diabetes? You can have a simple blood test to find out at your health center. The nurse just takes a drop of your blood and checks that for the sugar level. And so people who are overweight or have close family members with diabetes, you should have your blood tested on a fairly regular basis just to make sure that your glucose levels are normal. Another way to find out is to check your urine to see if it is sweet. Remember, we started by saying diabetes mellitus was first observed as a result of individuals recognizing the urine being sweet, okay? So again, the testing of the urine can be done at a health center or even in your doctor's office. So you can go and you request a urine test, and who knows, maybe they will test for other things in the urine since they would have that sample. But you know, you want to ensure that that urine is not sweet, because if there's excess glucose in the blood, it will also show up in the kidneys and then pass out through your urine, okay? Now, how do we treat diabetes? Type 1 diabetes, that's the one that affects mainly young people. That one needs to be treated with medicine in the form of insulin. So while insulin is a regular hormone, insulin could also be seen as a medicine because the type 1 diabetic needs that insulin as medicine. Everyone with that kind of diabetes, type 1 diabetes, needs to take insulin practically for the rest of their lives. And what the insulin does, that extra insulin, it would prevent the blood sugar level from rising too high, and so the individual would be kept pretty safe. Okay, now treating type 2 diabetes. That, as I said, affects mainly older people. and it is often treated with medicine. But many times that medicine is not needed. I'm going to come back to the screen, but let's look at something here. I want to introduce you to a very important concept, because most people who are diabetic get metformin as their first medication. I'm sure many of you, if you are listening and you are diabetic, or you know somebody who is diabetic, they will tell you, I either started using metformin and switched to something else, or using metformin and I'm still on metformin. But I want you to observe something here. Here's an individual just giving us their experience. And I'm just going to read the screen for you very quickly. And this person is saying, I take metformin for the diabetes caused by hydrochlorothiazide, which I got from the Ambien I take for insomnia caused by Xanax I take for the anxiety that I got from the Wellbutrin I take for the chronic fatigue which I got from the Lipitor I take because I have high cholesterol, because a healthy diet, regular exercise, nutritional supplements, and a positive attitude are just too much trouble. Just let that sink in. We don't have time to take care of the body, and so we end up taking all of these drugs and recognize one drug causes a problem, which causes another problem, which causes another problem, because you have to take different kinds of medications for each problem. And each of these medications, because they are not designed to be food, they have various side effects. And so to fix the effects of one medication, you are given another one and another one and another one. But remember, the father of medicine, that is the father of modern medicine, Hippocrates. I'm sure you would have heard this term before. Hippocrates, let food be thy medicine, and the medicine your food. Let food be thy medicine, and medicine your food. That is why our Creator Yahweh, when He made us so fearfully and wonderfully, He did not provide us with drugs. He said, I give you all herbs for meat. And then later His word said, herbs are of the nation. So we come back now and say to you, as you see here at the bottom of the screen, most people can treat this kind of diabetes, that is type 2 diabetes, by eating right and being very active. Recognize that's your medication. Eat right and be very active. And you can indeed treat diabetes. So that leads us right into what I'm very much interested in. I have a passion for reversing diabetes, and I cannot launch a program right here in my country on diabetes reversal. In fact, I should just share with you that when I did my natural medicine, my naturopathic medicine, my dissertation focused on diabetes reversal. I've already presented the results of my study, the Diabetic Association right here in St. Kitts and Nevis, and we are just waiting for an opportune time to launch a diabetes reversal program. And I'm pretty certain that that's going to be done very soon. But let's just share some information with you here. Because many studies suggest that a comprehensive lifestyle approach is the best defense to protect us from the ravages of diabetes. And that is all we need to do, ensure that our lifestyles are healthy. Now, many diabetics can normalize their blood sugar levels, often within a matter of weeks. In fact, sometimes even as quickly as 3 weeks, 21 days, by adopting an optimal lifestyle program. And I just want to share with you 4 key points that you need to bear in mind. Number 1, if you're going to reverse diabetes, you want to eat a low-fat diet. Lowering the amount of fat and oil in your diet plays a crucial role in preventing and the reversal of type 2 diabetes. When less fat is eaten, the sensitivity to insulin is gradually restored. You see, the more fat you use, the more insulin resistance sets in. But you get rid of that fat and you allow the insulin to do its work effectively. So the way to achieve this is to eat unrefined diet with the exclusion of all and all refined foods. Again, too many people consume junk foods. That's what we mean by refined foods, junk foods. All of the plastic bag stuff, the ice creams and candies and sodas, hamburgers and chicken and chips, you name them. Junk foods packed with fat, and they will cause insulin resistance to set in. Then you want to eat a high fiber diet. So eating more natural fiber-rich foods plays an important role in helping to stabilize your blood sugar levels. Foods high in fiber include whole grain cereals and breads, cooked beans and peas, fruits, vegetables. And if you look at this picture here, you'll notice we have a wide variety of stuff that you can use to get your fiber, the breads. And we're not talking about white flour bread. We're talking about wheat breads or seed breads. You might have heard about the Ezekiel 4:9 bread. I don't know if you would have it in your countries. We have it here in St. Kitts. If you go and read Ezekiel 4:9, you'd understand what Yahweh said to Ezekiel when he wanted him to go and lay on his side for 365 days. He gave him a diet of bread made only from seeds. And right now, they still sell Ezekiel 4 bread today. Other seed bread, good seed bread, or power seed breads, you name them. There are different types of seed breads, but they are very much available. And so those are the breads you'd want to use in addition to your cereals and your beans and peas and so on. Now, our Father, our Creator, made, and this is a quote, made very good food for us to eat. He made fruits, vegetables, nuts, and grains like rice, corn, and wheat for us to enjoy. The best way to eat the foods is to prepare them in as simple a way as possible. So you want to eat your foods as close to natural as possible. In fact, take a choice here. Brown rice is so much better and stronger for you than white rice. You know, most people consume white rice. But what is white rice? White rice, just like white flour, is refined. And remember I said refined foods are the culprits in diabetes. So you don't want to eat white rice anymore. Go for brown rice or quinoa, right? Or other grains. You have quinoa, you have amaranth, you name them, okay? The same applies to whole grain flour, which is so much better than the processed white flour. Now, people with diabetes should not eat too many energy foods like potatoes, yams, rice, and high sugar fruits or bread at one meal. You want to spread out. In fact, if you look at this diagram, you'll see two different types of potato here. And I put them here because I want to make a distinction. The white potato is referred to as a high glycemic index food. What does that mean? It means that 100% of the glucose shoots into your blood very soon after you've consumed that meal. In fact, some of it actually goes into the blood even while you are chewing the potato, because you know digestion starts in the mouth. And so sugars, as a result of the saliva acting on them and so forth, will be broken down, and the glucose is already a simple sugar in the white potato that goes just straight into your bloodstream. The sweet potato, on the other hand, the sugar is digested at a much slower rate, and so it takes a longer time for whatever sugar is in the sweet potato, the glucose from the sweet potato, to be digested and get into your system. And so The sweet potato is referred to as a low glycemic index food because the sugar does not get into your blood as fast as the white potato. Therefore, I would encourage you, if you're going to eat potato, choose the white potato, the sweet potato, sorry, over the white potato, okay? So the blood sugar could increase rapidly even if the food does not taste sweet, as I said, like the white potato. The white potato doesn't taste sweet, but it forces the sugar into your body. And you can do a test. I'm sure some of you would say, but bread don't taste sweet when I'm eating it. One of the reasons the bread does not taste sweet is because you swallow it too quickly. But when we finish this presentation, you can do a little test. If you have bread in your house, just take a bite of bread and just chew it. Just keep chewing it for a while. Chew it for about a minute or two. And you will notice that the longer you chew that bread, the sweeter it tastes. Why? Because the starch in that bread is being broken down to sugar right in your mouth. So you understand what we're saying. So you can do the test and you'll know for sure. Okay? Now the third thing we need to do is to exercise regularly. Through regular exercise, the need for insulin injections can often be reduced, and oral medications frequently become unnecessary. Exercising your muscles need fuel. As I said earlier, gasoline is to the car as glucose is to your body. So you need that fuel. So regular physical activity enables the sugar to enter your body cells, even without the insulin. So exercise on a regular basis. I cannot run anymore, so I walk. And number four, tip number four, achieve a healthy weight. Achieving a healthy weight is of vital importance in reversing diabetes. If you're overweight and you're diabetic, one of the things you want to do is to get rid of that weight. Health experts warn that obesity is rising to epidemic proportions, and they say that the majority of type 2 diabetics are overweight, and often all it takes to bring the blood sugar back to normal is normalizing your weight. So get rid of the weight. And I'm not saying that you must live on the scale because sometimes people become obsessed with the scale. So it's not about the scale, but it's about you doing what is necessary to get rid of the weight. And then you can visit the scale maybe once in a while, say once every 2 weeks or once a month, as the case might be. But you just want to get into doing those things necessary to get rid of your weight, okay? So those are the 4 tips for preventing diabetes. Now, for those of you who are not diabetics and you want to know how to prevent diabetes, we will share some information with you. Because often people believe that they only have to stop eating sweets and sugar to avoid getting diabetes. This may help, but usually you need to do more than that. It's not just about sweets or sugar. So in summary, here are some suggestions for you. Number 1, if you're overweight and you're not yet diabetic, lose the weight quickly. It's important to lose that weight. You need to eat well, to look good, but heavy people often become sick with diabetes and many other serious diseases. In fact, one of the other diseases that afflicts obese individuals is hypertension, because the more fat you put on, the more blood vessels you need to circulate that blood all around the body with the excess mass, and so you're going to be putting more strain on your heart, your blood vessels, hypertension sets in. Number 2, to prevent diabetes, and I've increased the variety right here, you want to eat healthy foods. And I usually tell people, when you eat naturally. For example, if you look at these 3 pictures here, I'm sure you can identify every single color in the rainbow. So you want to eat enough vegetables and fruits and nuts and beans. And if you're going to eat flesh, just a little if needed, just a little, okay? Just a little. Thirdly, you want to eat less fat, especially fat from animals, because that is really not good for you. I believe those of you who were on the presentation last week would have heard me emphasize the need to get animal fats out of the system because of the impact of fats and cholesterol on the blood vessels. So the same thing applies to diabetes. You want to eat less fat. And number 4, be active. Be active. Engage in some kind of exercise. Work with your muscles. Just work them, work them, work them. And that will help you to be healthy. Choose your form of exercise, whether it is running, jogging, swimming, cycling, walking, even dancing. Some individuals, their form of exercise is just dancing. You know, you put on that exercise music and you move various parts of the body and you have a good sweat, fine. But you need to be on the move. And finally, number 5, permanent lifestyle change. So that if you are accustomed to eating junk, you want to make that switch. If you're accustomed to eating high-fat foods, you want to make a switch. So you want to make a switch to low-fat, plant-based diet. Eat most of your calories in the morning and about midday. You don't want to be eating too much in the evening. You know, again, here in the Caribbean, people have adopted the lifestyle of the Europeans and the North Americans of having dinner at evenings. And dinner is that large plate of food. So that you're taking in most of your calories in the night. What are you going to do after that? You're going to bed. And so you're going to bed while your stomach is trying to struggle to digest all of that food. And then you wake up with indigestion in the morning, you wake up tired, you wake up, you know, fatigued, and you wonder why. That's because you did not give your body the opportunity to take in the nutrients early in the morning, burn the calories off during the course of the day so that you could have a good rest at night, okay? So that's what you want to do. Coupled with active daily exercise, those things could help you experience lasting success. So let's just reflect, let's review, and I just need to wet my throat here because here in St. Kitts it's extremely hot. You might see beads of sweat coming off me right now. Okay, so we just want to reflect a little bit on what we would have learned so far. As you can see, diabetes is largely preventable. It is preventable. The good news is that those who already have diabetes can control it, yes, but you can also reverse it. Many can reverse it without drugs by simply following a healthy lifestyle. Okay? So if you have diabetes, try not to focus too much on control because you're going to have it for the rest of your life and it could create all kinds of problems for you. What you want to do is to strive to reverse it. It is tragic that it often takes irreversible complications before people really get serious about their diabetes, whether, you know, heart attack, blindness, amputation, whatever it is. Don't wait until a heart attack or blindness or amputation serves as a wake-up call. You have the information now, act on the information, okay? As this individual said, well, they said God, we say Yahweh, gave us simple advice in his word that could help us to have the very best of health. Right in Proverbs chapter 27 and verse 12, it says, a prudent person foresees the danger ahead and takes precautions. The simpleton goes blindly on and suffers the consequences. So we don't want you to be a simpleton, but we want you to be a prudent person. As serious a disease as diabetes is, the old adage can apply. An ounce of prevention is worth a pound of cure. So start now. Disarm diabetes before it happens. And that is the end of our presentation for tonight. Remember, you can disarm it before it comes on. And even if it is there, you can prevent it. You can prevent it. So there is hope. There is hope. Thank you very much for listening. And as you can see, somebody has the thinking cap on because they might have some questions. And so if you have any questions, I'll be very happy to try my best to answer your questions.
Thank you so much, Dr. Carty. So I'm checking the Facebook to see if we have any questions. Let me turn on my camera. We do not have questions yet, but I do. And we also
Okay.
have a guest. We have a guest here. I don't know if she wants to go ahead, guest first, and ask question. If you can unmute your mic. Um,
Yes, good evening. Thank you so very much, Dr. Carty. Wonderful presentation again.
Thank you. You're welcome.
Yes, we wanted to know about the different types of insulin because we found out that there is a plant-based one and there is one that probably has pork in there. So as
Okay.
believers, we really need to know what is being put into the body. Can you enlighten us a bit, please?
Okay, what you said the first one was?
Plant-based.
Oh, plant-based.
Yes.
Okay, I have to admit that I have not done research on different types of insulin, and maybe maybe for good reason, who knows? Because my focus is not so much on medication. My focus is on helping individuals to take care of themselves naturally. But I would not be surprised because a lot of medications, a lot of additives are actually based on that diabolical, abominable animal called the swine. And it's a trick of the evil one. In fact, even some hormones that are put in our foods, for example, there's a hormone called BST, bovine somatotrophin. That hormone is given to cows to enhance their milk production. Where does that hormone come from? The pig. So I would not be surprised if insulin is extracted from the pig and given to individuals. And it is for that reason why I would suggest that if you're on insulin, mark you, work with your healthcare provider, but try as much as possible, if you are not type 1 diabetic, to reverse that diabetes. Okay? And as I said, you can do it by making those necessary lifestyle changes.
Thank you, Dr. Carty. Thank you for the wonderful tips you provided tonight.
You're welcome.
Thank you, sir. So a quick question. Is
Yes.
insulin good for us? I'm going to piggyback on what she's saying because she asked for plant-based, but is insulin good for us, for our body?
Well, I am not sure I would use the term good in the sense that, you know, say protein is good for bodybuilding. You see what I mean? Or glucose is good for fuel, right? Now, insulin is necessary for type 1 diabetics because remember we said type 1 diabetics are not producing insulin. So insulin as a medication is necessary for that type 1 diabetic to get that sugar out of the bloodstream into the body cells. Now the type 2 diabetic, if that individual's diabetes has gone so far that the beta cells in the pancreas are compromised and that individual is not producing enough insulin, then again, that individual needs to get insulin from outside, all right? But if the individual simply has high blood sugar, but the pancreas is working fine, it is producing insulin, the only problem is that there is insulin resistance, then that individual has to do those things necessary to reverse the diabetic condition. So there's no need for insulin. In fact, some individuals tell me that as soon as they become diabetic, one of the first things doctors want to do is start them on a course of insulin. You know, and that to my mind is not quite the best, because then what it does is it prevents you from, you know, giving the body that natural means of restoring or regenerating itself, because the body does regenerate itself. It tends towards healing itself naturally. That's how fearfully and wonderfully we are made. Yahweh knew what he was doing when he designed us. He knew exactly what he was doing.
Great. That's a very good answer. And so for someone who like kids, you know, kids have diabetes and all of that because of what the diets that the parents have already made for their kids to become diabetic, and you will see the weight gain in the child and all of that.
Yes.
What can dietary food change it? Is it because they're younger they can change their diabetic status quicker or faster by going on healthy foods or fasting? Or
Um, I hope you are referring to type 2 diabetes,
yes, sir.
because where the child has type 1 diabetes, there is not much more you can do but to give insulin. Okay?
Yes, sir.
Even as they're using insulin, however, yes, you can modify the diet. You can make sure that they're on a good exercise program. You don't want to compromise and to make things worse by giving them a high-fat diet, by giving them an animal-based diet, by giving them a junk food diet. You see what I mean? So you want to provide them with a good plant-based diet, foods that are as close to natural as possible, and you want to ensure that they exercise effectively. Okay? Because that's the problem with children. It's mainly type 1 diabetes or juvenile diabetes. Yes, you can have a child with type 2 diabetes, but this is not the norm. Type 2 diabetes tends to affect older individuals. The term
I think we got a connection break somewhere. Yeah, there's a break in your background, sir. Now we can hear you. I think let's see. Maybe turning the mic on and off again will help. Yeah, let me see if it's my end. Um,
Hello?
yes, hello. Yes, sir. Oh, it's your headset. It's your headset.
Hello, you hearing me?
Yes, sir. It was the headset. We got lost for a moment.
Okay, sorry about that.
That's fine.
Any other questions?
Any other question? Yes. So apart from you said that in the diabetes one, it's like hereditary. They have to take insulin. Is that what you're saying?
Yes, yes.
And then diabetes two is our own ways that have created habits and eating that have created this ailments that we have. So my question would be like eating natural. Some people say going vegan, vegan diet. I was on a vegan diet. Would that adversely reverse the effect? Because you see a lot of people who go on vegan diets start talking about how the effect is lesser on their health diets also, sir. So that would be my question. Let's say on their health predicament, sorry, not health diet. The more they eat healthy, their health predicament goes for a better turn. They feel healthier, they feel lighter. And another thing about exercise regimen, will that also help for type 2 diabetes? Or it's just one of the things we're saying eating right, exercise, it's there, but there are other natural remedies that we can add to that, or herbs or things like that.
Okay, I guess I did not emphasize it enough, but I'm sure you would have heard me say in the presentation that one way to reverse type 2 diabetes is to move to a plant-based diet.
Yes.
Remember I said that? Right. So a plant-based diet is a vegan diet.
Yes.
Because it is plant-based, you see. In fact, when I said to individuals, okay, I can help you reverse your diabetes, that is exactly what I recommend to them. A plant-based diet and exercise, those two. In fact, you remember I said once you do those two things, within about 3 weeks, you can see the signs. In fact, the Wiener Institute up in the US, the Wiener Institute, I think there's another group. I don't quite remember their name right now. But the Wiener Institute, they have done research on reversing diabetes. And what they have found is that in about 90% of the cases where they put the individual on a vegan diet and exercise, that the diabetes is reversed in 17 to 21 days. Plain and simple.
Wow.
I mean, what medication do you need to reverse diabetes? What the medication does is keeps you dependent on it and keeps you diabetic, you see. And so that is why the allopathic doctor will say to you, well, you have to control your blood sugar, because they don't quite understand that nutrition is the key. You see, in allopathic medicine, the focus is not on nutrition. The focus is on chemistry and pharmaceutical drugs, surgery and radiation and those things. But in naturopathic medicine, our focus is on natural means of healthcare. And where do we start? Nutrition. Why? Because most diseases start where? In the gut. And it is based on what we eat. In fact, I should say something that individuals who are meat eaters might find interesting and informative as well. Research has shown that 9 out of every 10 diabetics, 9 out of every 10 diabetics, that is 90% of type 2 diabetics, are diabetics because they eat pork.
Wow.
You see, lots of people think that diabetes is as a result of eating starch and sugars. But no, pork is one of the main culprits in diabetes. And where you see a high incidence of pork eating, you will see a high incidence of diabetes. And I'm not just guessing that, but medical research has shown that, okay? And so I say that because, again, medical doctors tend to, want to give nutritional advice, while that is not their forte. And so what you find medical doctors say to individuals is, okay, you have diabetes, you can control it. And what you need to do is watch what you eat. And you can eat, okay, don't eat the red meats, but you can eat. They heard somebody say something. And so don't eat the red meats, but you can eat the white meats. And what are the white meats? Chicken, turkey, rabbit, and pork. Those are listed as the white meats. But guess what? Chicken is a high fat meat. Pork is high fat. And not only that, pork tends to cause type 2 diabetes. So then how would your medical doctor tell you to continue eating pork because it is a white meat, and that pork will continue to keep you diabetic? You see what I mean? That's for those people who eat pork, okay? And flesh eating, and that is why we encourage people who want to reverse diabetes to simply get rid of all meats, get rid of the flesh, okay? Because that extra fat in there builds up, forms glycogen, that glycogen is then converted to glucose and so forth, and the cycle goes on and on, okay? So a good plant-based diet and exercise will help you to reverse diabetes. We can't stress that more.
Great, because this is a good question for the skeptical. Like, well, I'm tired of all these vegans saying that. Some people might have missed that in your presentation and be like, well, is it true that? Because I felt the difference when I was on a vegan diet, and I'm going to transition back to it sometime soon. I felt the difference in my body in certain things healing also. So you feel different. It does not happen overnight, but for some people, but you do sense the difference. And some people do it to lose weight, and once you're off it, you gain the weight. That's the thing. Also, you gain.
Because they go back to eating the same junk that they were eating before.
That's what I
And
mean.
then you end up with a yo-yo kind of experience.
Yes.
And if I would share my own experience with you, for disclosure, I am from a diabetic family. My mother was diabetic. My father was diabetic. In fact, my mother was both diabetic and hypertensive. Her mother was diabetic and hypertensive. A number of my siblings are diabetic. In fact, one of my younger sisters, she passed away in 2010, having lost the use of both kidneys, was on dialysis for 3 times per week, before she passed. And our diabetes is not hereditary. And again, one of the first things doctors ask you when you go to them and you present with diabetes or hypertension, anybody in your family has it? Yes, okay, so it's hereditary. And that is so not true. Remember, what you're eating now is mainly what your mother ate or your father, and what they ate is what their parents ate and their parents before them. Hence, you have diabetes coming down through the lineage, and then one would look at it as hereditary, when in truth and in fact, it is based on lifestyle. And I remember around the end of, during 2001, I actually began to experience the symptoms of diabetes. And that's because of my lifestyle. And so when I recognized what was happening, I went into doing research to find out what I can do to reverse this thing. Because I did not want to become full-fledged diabetic. The symptoms were there, yes. I was pre-diabetic. I said, no, I need to fix this. And I went, did the research, found the answers, and the first thing I did was to take a trip to Anguilla, because that's where most of my family lives now. Share the information with them. And unfortunately, the same sister who passed looked me in the eye, and she said, I saw you in Lincoln, but you ain't gonna tell me what to eat. You will not tell me what to eat. I had to watch my sister suffer and die. But at the end of 2001, 1st of January 2002, I like the start of the year. I make lots of transitions at the start of the year. I started a cleansing fast. And I did the 10-day lemonade diet. And then I came off of that fast and went straight onto a vegan diet. And I was vegan for 10 straight years until 2012. From 2002 January until 2012, I was vegan. Right now, I have no signs of diabetes. I've gone back to eating some fish only because I heard my nutrition professor. He said every summer, he's vegan, but he said every summer he eats fish for 2 weeks. And in those 2 weeks, he could feel a difference in his body, based on just consuming that fish for that short time. And man, I came home from Florida and I was like, okay, I think I can eat some fish. I told my wife, man, my nutritionist, professor, he's a vegan, but he eats fish now and then. And so I started eating fish, and I don't just eat 2 weeks a year. Oh boy, now and then,
Yes.
fairly often. But when I don't eat fish, I eat vegan.
Mm.
Okay?
Yeah.
Yeah. And up to today, my food was vegan, total vegan, total vegan. And so, but yes, I do eat fish now and then, but I'm not diabetic. And so you can live without diabetes, even if you are predisposed to it.
And you see, this is another question I'm going to ask. Some people are going to be like, it's weird, but then I'll give Miss, after this question, maybe Miss Mags, I have more questions to ask. So I'll give her the platform. So I've had people saying, oh, when you get rid of the sugar and you start eating fruits, they'll be like, oh, the fruit have more sugar. Keep away from banana. It's too sweet. You hear that from the grapevine. This is not a very, it's not from a professional or educative source. And
Yeah,
you hear people say that and you want to be like,
yeah,
where are you getting this from? And then you hear even some health professionals, I'm not going to talk which part of the world, are saying something about fruits being too sweet. So, are there certain fruits we should keep away from? Is bananas bad for people with diabetes?
the thing
Ripe
about
banana?
fruits, the thing about fruits is that they have fructose, which is good fruit sugar. But let's face it, you don't want to sit and eat a whole set of bananas one time. You don't want to sit and eat a whole set of grafted mangoes one time.
Wow.
You eat one banana today, that's fine. You eat a mango tomorrow, that's fine. You eat an apple the next day or two. You see what I mean? It's a matter of eating in moderation. But there are some individuals, they want to consume as much as they can, as if there's no tomorrow, and that is really the problem, you see.
Uh-huh.
So one has to be just wise. Just be prudent in the way you eat, okay?
Yes, sir.
But
Thank
yeah,
you.
but fruits are safer to eat than high-fat foods, most definitely.
Great. So the platform is still open for questions. If you can type it on Facebook. I don't know how long Dr. Carty wants to be here for, but any
Yeah.
question, he's looking at his time. Any question is open. Miss
Okay, we
Mag,
could have a few more minutes.
a few more minutes. Do you have more question, ma'am?
Yes, I do have another question.
Okay.
Dr. Carty, some people have been saying that whole wheat flour sends a wrong signal to your body. So whether you eat white or whole wheat, it doesn't really matter. Is that true?
Well, it depends. I think the real problem here is that some people are gluten intolerant. And I think you'd find more of the, well, not necessarily, whether it's white flour or um, wheat flour, you'll find the gluten in the flour. But as far as I'm concerned, the wheat flour is much better than the white flour because it has that fiber that the body needs. It is closer to natural than the white flour, which is more processed and which is just high starch. And so the preference should be the wheat flour. However, if the individual has an intolerance to the whole wheat, then I would not suggest that they continue to use it. What I would suggest is you find an alternative. For example, you can have rye flour, quinoa, sorghum, amaranth, you name it. There are various spelt. So there are lots of different types of flour. In fact, there is a brand, while I'm not here to promote any particular brand, but there is a brand coming out of the US called Red something. Oh, look how I forgot. Um, Look how I forgot. Anyway, but that company makes lots of different types of flour. And what they do is that they grind the seeds. The seeds are stone ground into flour. So when you buy spelt flour, you're getting spelt flour made mainly from spelt seeds with no processing. You buy quinoa flour, same thing. Sorghum flour, same thing. I like the idea of buying different types of flour, and so when I bake, I have a combination of those different types. Yeah. So you don't have to stick for white flour or whole wheat. So go to the supermarkets, search them out. Any other question?
Thanks much.
You're welcome.
Yes, thank you, Dr. Carty. And so I have one last question. You know, we have people who go into diabetic coma and they're like, oh, I need this insulin. And we're talking about going vegan. Would the advice be like while they're on insulin, they start the plant-based diet and start reducing? Some people have to take some insulin shots a day. And then they are like, if they don't get it, they go into that diabetic coma. What advice would be for them?
Again, what you're going to do has to be done with your healthcare provider monitoring. Now, it is true that there are some of them who are totally against anything natural. Others who will work with you. And so if you find that this is your choice, but I'm going to say it. If you find your healthcare provider is not interested in working with you and your natural approach, then find another one who is. I mean, I go to the doctor, let's face it, but my doctor is very much interested in naturopathic medicine, even though this individual is an allopathic doctor. He's an allopathic doctor, and he surprised me one day while I was in consultation with him by pulling out a textbook on the philosophy of naturopathic medicine. In fact, when my daughter, who is also a naturopathic doctor, and I were at the hospital one day, she was addressing medical doctors and nurses at the hospital, speaking to them about naturopathic medicine. One surgeon decided to, resist what she was saying, and my medical doctor stood up and defended us among his colleagues, and I really appreciate that. He said, I am a strong believer in naturopathic medicine, you see. So I can trust that physician, right? So, you have to just find an individual who will work with you. I'm not suggesting that you simply come off insulin and go to a plant-based diet. That would not be wise. Because remember, if you're going to make changes, the body has to adapt to those changes, okay? And so while you might want to, yes, you can come off of an animal-based diet anytime, right away, for sure. But if you're going to go on a plant-based diet, you'll still need to monitor the sugar because your body is not going to just change overnight, okay? It's going to take a while. So ensure that you have a doctor who's going to work with you and who is positive towards, that natural approach. In fact, one of the things I said to people is that both areas of medicine need to come together, shake hands, and work together. It's not a matter of being, and like some of my clients would say to me, oh, my doctor tell me don't study Carty, he's just a herbalist. No, I'm not just a herbalist. Herbology, it was one of the courses I did. Yes, in fact, I did introduction to and I did advanced herbology. I can make my own medicines, but I have a job, and so I just recommend to people what they need to take, where they can find it, and so on, right? But let's face it, we need to work together for the benefit of the individual. And I'm working along with any medical doctor who is going to work with me. In fact, I must say that there are actually 3 medical doctors here, 3 or 4, who are very much interested in the diabetes reversal program I'm going to be starting sometime soon. In fact, they said to me, well, as soon as you're ready, let me know. We're going to send our patients, you see. So yes, there are those who are open to, and you find those and work with them.
Okay, great, thank you. And I get all what you're saying, meaning that if I want a holistic approach, I file a holistic doctor. If my doctor is reluctant, to see how they can work with me in herbs and stuff. That was my other question, but we don't
Yes.
have time for that about the herbs. What herbs would you recommend? But next week, I think this is the time I'm going to hand over the platform to you to talk to the viewers, and then I'll check and see if we have any more questions coming in, and the to tell them about next week, and then I'll thank you for being here. Yes.
Okay. So what do we do next week?
Yeah, next week is up to you, sir.
Um,
Topic.
there is something else that people are concerned about. Lots of folks suffer heartburn, what we call acid indigestion.
Yes, sir.
And there are all kinds of ads out there. And people spend money and they don't get any kind of relief. I think we could touch on acid indigestion and look at some natural ways of relieving acid indigestion. Because of the eating habits, there are lots of individuals who suffer acid indigestion. So we could probably do that next week.
Okay, sir, great. And to our viewers, if you want to reach Dr. Carty, his information is on the screen. I think that's your telephone number, your Facebook, and your email
Yes,
address. So you do you want
correct.
to touch on that, sir? And
Yes, the well, my mobile number, that's where you'll reach me easily since I am in my office most of the day. That's 869-665-8968. And you can find me on Facebook, Lummery Natural Health Consulting. My email address is lummerynhc. Again, that's the short for Natural Health Consulting. So it's lummerynhc@gmail.com. And then I have a website because I do promote some products. One of the main ones I promote is a product for nitric oxide therapy. It's called Proarginine Plus. And the website is drcarty.synergyworldwide.com. Remember, if you want to get to my site, don't just type in Synergy Worldwide because you'll be going to the parent site, and I would want you to purchase from me, from my site. So you can visit my site. You'll not only get Proarginine Plus, that would help in hypertension, diabetes, cognitive function, ED, sexual problems with men, enhanced performance for people who are athletic. Those are some of the benefits of Proarginine Plus. But there are other products on the site. You have weight loss products, you have beauty products for the ladies. So you can just go on and browse on the site and you'll find something for your needs. That's drcarty.synergyworldwide.com, as you can see at the bottom of the screen there.
okay. Thank you so much for being here, Dr. Carty, and for your education and this
You're
presentation.
welcome.
Yes, and Yahweh bless you. Thank you, Miss Max, for being here. Yahweh bless you and for your question, ma'am.
Thank you.
Thank you. Pleasant night, everyone. Yashua's
Good night.
guidance.
Pleasant night
Yahweh
to
bless
you.
you all.
Okay.
Good night, viewers.
Okay.
And this is where we will end the live stream. Bye.
Right.